So good morning. My name is Cindy Schorzman. I'm the medical director here at Student Health and Counseling Services. I'm also the project lead for campus COVID-19 screening and contact tracing. So I wanted to give you an overview of kind of where we've been, where we are now, and where we're going together. As you may be familiar with this project and may not, this project is really important for our campus. So why do this? Why are we all in this together? It is an innovative, cost-free, and a quick, simple way to monitor your personal health. It's a rapid test with most results communicated within 24 to 48 hours, and you're helping our UC Davis community. We're helping identify those individuals who do not have symptoms of COVID-19 but may be infected and may be able to infect others. So you're playing a really important role in helping keep our campus as safe as possible. So I wanted to give you some information on the three arms of this project and kind of where we've been. But first, we're going to show you an introduction about what our kiosk testing experience is like.
Hi there. You're probably getting ready for the coronavirus screening kiosk. Here's what you need to know. Every student, staff, and faculty member on campus will have to do regular saliva testing. Before arriving at the testing kiosk, complete the COVID-19 daily symptom survey. If you have symptoms, don't come to the kiosk. Call Student Health or your doctor. Schedule your appointment online and have your appointment QR code with you. Stay well hydrated and drink plenty of fluids about 1 hour before your appointment. In the 30 minutes before your appointment, make sure not to eat, drink, chew gum, or smoke. When you arrive at the testing location, keep physical distancing in mind and keep your face covering on except when submitting your saliva sample. When it's your turn, use hand sanitizer before approaching the registration tables. The attendee will scan your QR code and ask to see your ID. You'll be handed a pipette bulb with some water, a straw, and a small vial with a unique barcode that's linked to you. Don't lose your vial. When you're done with registration, you'll be directed to a testing table. When prompted by the attendant, lower your mask and tip the water from the pipette bulb into your mouth and gently swirl it around. Don't swallow or gargle the water. Place the empty pipette bulb into the container provided. Unscrew the cap from the vial and place the cap in the container. Next, insert the straw into the vial. Be careful not to push the straw so far that it creates a seal. Place your lips on the straw and push saliva through the straw into the vial. After filling the vial a little more than halfway, remove the straw and place it into the container. Gently twist the cap back on the vial, not too tight though, and place it in the container. The attendant will take your sample. Replace your face covering and use hand sanitizer when you're done. That's it. Your results will be texted or emailed to you. Thanks for being part of the solution here at UC Davis. Enjoy the rest of your day.
So we will go through the timeline together. So just so you know, this project actually had three arms to begin with. We had this mass screening campaign. We had actually parallel testing because this was a new test developed by UC Davis campus at the Genome Center. And so we had to show that this test actually worked. So we actually, if you participated early in our project, you may have had a nasal swab and a saliva test. We did those together to make sure the saliva tests work. We're no longer doing the nasal swab. So now it's saliva only. And we do contact tracing, which I'll talk about in just a second. So where we've been, we started this on September 14th. We actually rolled this out, and our pilot project was with those individuals who were moving onto campus into UC Davis facilities as part of our residence halls. And then we've expanded significantly since then. So we actually expanded to include Greek life residents, first responders. We had bigger and bigger circles, and as of 11/18, we actually expanded our invitation to include all UC Davis employees and students. So we're very excited about that. As of 11/23, we have had 42 positives. And these are asymptomatic individuals come through the kiosk, and that's out of almost 32,000 tests that we've done. If you want to help keep abreast of the numbers, there's actually a really good COVID-19 dashboard. There's a couple actually. There's one that is at Campus Ready, and that's our asymptomatic kiosk. And then you can see the link here if you're interested in all the other positives on campus. And those reported through the COVID reporting line, and those who present to Student Health and Counseling Services as symptomatic, and we do testing here. Those are at the Safety Services website as well. So you can keep track of the numbers in real time, just like we're doing. Next slide, please. Great. So just to give you other updates of kind of where we've been and what this process has looked like. So how we did this is we started out with this pilot project. We achieved CLIA certification of the Genome Center pop-up lab as part of our student health and counseling CLIA license. And then we had to validate the test, as we mentioned. So we did those parallel tests, including those nasal swabs. And then in late October, we were able to validate and switch to saliva only. We started at 4 days a week. And then as of November 1st, we expanded to 7 days a week. And that does include a longer day on Wednesdays, 6 a.m. to 6 p.m. To allow other shift workers to be able to access our kiosk as well. You might have seen us originally in the pavilion parking structure. We moved to our winter kiosk location in anticipation of inclement weather, and we did that on 11/12. And as I mentioned, we expanded to all UC Davis employees and registered students on 11/18. So the FAQs on this is, how does a test work? Well, it's actually a PCR test. And really what it's doing is looking for the virus. So this is not an antibody test, and this isn't an antigen test. This is actually looking for little particles of the virus itself, and it's looking for them at a level that people are likely to be infectious. And then the other question was, is the pavilion the only on-campus testing site? Right at this second, the answer is the kiosk at the ARC is actually the only on-campus testing site. We were at the pavilion parking structure, as I mentioned, until 11/12. As of 11/12, we are only in the ARC. We are in the four-court basketball court, and that's where our kiosk is right now. There are a couple other efforts underway right now, including a mobile kiosk that we're hoping to do a soft rollout in December and a more robust rollout in January to help kind of meet needs of other areas of campus as well. And we're also partnering with Healthy Davis together to see what testing for employees and students would look like at that kiosk, because they're moving into the Mondavi as of early December. So more to come on additional testing sites, and there'll be a lot publicized when we get those up and running. But for right now, the only testing site on campus is at the ARC four-court basketball court. All right. Just briefly again, what are the hours? Cool. The on-campus testing kiosk that we've talked about at the ARC basketball courts, we are now open 7 days a week, 8 to 5, except again on Wednesdays, we are open 6 a.m. to 6 p.m. to help accommodate that range of work schedules. Next slide, please. So you saw a little bit in the video about how to make this appointment. As a reminder, as they stated in the video, this is for asymptomatic individuals only. Employees with symptoms are directed to call your own medical provider or occupational health, and please follow their directions. If you're asymptomatic, please make that appointment online. You're actually coming to our Student Health and Counseling Center point and click electronic patient portal. There's step-by-step instructions which will be provided. And we already should have your name and information in our system. If you have any problems making this appointment, please email that address, the email address that is provided in the slide deck, or call that phone number. We're having particular issues with lifelong Aggies, people who used to be students and are now employees. You are awesome. And we also are having problems with you in our database. So we have to fix you manually one by one. So please, we appreciate your patience, and please do notify us if you're having any trouble logging in to make your appointment. Next slide, please. Maybe. Great. So as you saw, making your appointment, you do that on the patient portal, and then you're going to get that QR code. You can print it out if you want and bring that printed copy, or you can bring it on your smartphone. And when you get to the kiosk, they're going to ask you to show two things. They're going to ask for that QR code that shows you have that appointment. They're also going to ask for you to show that daily symptom survey approved electronic badge in order to proceed through the kiosk. The frequently asked questions: can we get tested the same day we visit campus? Yes. And this question has come up a lot actually for people who are on campus less often than once a week. You can absolutely come the same day that you're coming to the kiosk. At this point, you don't have to make a separate appointment. You can just come that day. And the next question is, can my family members get tested too? That is a great question. So right now, our kiosk at the ARC is for employees and registered students. But as I mentioned briefly, we are partnering with Healthy Davis Together, HDT, and what they're doing is paralleling our process for the rest of the city of Davis. So they're bringing online testing for anybody who works or lives in the city of Davis, but is not eligible to come to our kiosk because they're not employees or registered students. So HDT, Healthy Davis Together, is going to get those kiosks up and running, and you're going to hear a lot more about it. Their pilot has been very successful, and they are moving into the Mondavi Center at some point in December. So there is going to be a better mechanism to get tested, including your family members. So next slide, please. Please. So this is a picture. So some of you may notice that this is the ARC, and we can see where Pete's Coffee used to be, and hopefully will be again. But in the blue circle is the current kiosk entrance. And so this is where you're going to come for your asymptomatic testing. Next slide. Great. And this is what our new inside kiosk looks like. This is where we moved for our winter location. So I want to emphasize that we actually coordinated with infectious disease specialists at UC Davis Health, and we coordinated with environmental health and safety on campus, all to find the safest place on campus possible for inside testing and to keep it safe. So you can see that we're incredibly physically distanced. We're actually 10 feet apart inside just to be extra careful. And you can see some of the safety measures, including the personal protective equipment worn by our kiosk operators and our plexiglass. FAQs is how can I be tested outdoors? So right this second, because of the anticipation of inclement weather, we do not have an outdoor testing option. We hope to move back to our outdoor testing option as soon as the winter's over. So our goal is to move by February or March back into the pavilion parking structure. Is the test sanitary? Absolutely. You can see our setup. We take great pains and have very specific protocols to clean frequently and to keep everything as safe as possible. And how is the campus limiting the amount of time I spend testing? So that's where the appointments come in. So we are actually doing the appointments for physical distancing reasons so that we can try and help regulate how many people are in line and how many people are going through the kiosk at the same time. You can also see that we hired lots of people. These are the most awesome kiosk workers that keep this process up and running. And the reason we hired lots of workers is because we wanted you to be able to spend as little time here as possible, because we know you have other things to do. And so the number of workers helps to keep the line moving. We also have some incredible students who are also helping manage the line, make sure people have face coverings, all of that good stuff, also to help minimize and speed up the process. So you're spending the least amount of time at our kiosk possible. Next slide, please. All right, so test results. So these tests are ordered by occupational health providers through our system, and you're going to hear your results from an occupational health provider. Most of the time, this is going to happen within 24 to 48 hours. Because of the increased testing volume that occurred as of 11/18, test results are being slightly delayed right now, but please reach out if you have not heard your test result within 72 hours. Negative results, you're going to get an electronic communication. You're going to get an email that says, hey, you have a test result waiting. Please log in to get your test result. Positive results, you're going to get a phone call. You're going to hear from an occupational health provider or a designee that calls you, lets you know your results, and kind of walks you through the next steps. Make sure you understand what your positive results mean. Make sure you understand what isolation means, and really get you connected with resources. The FAQs, will the test reveal antibodies or if you have had COVID-19 in your system at any point? That is a good question because it gets confusing because there's a lot of different kinds of tests out there. The short answer is no. This is not an antibody test. So what we're looking for in this screening test is, do you have COVID-19 right now in a level where you may be infectious to others? That's what this test is really geared towards. It will not tell you if you had COVID-19 in the past. Those kinds of tests are generally blood tests and are done in a different mechanism. Who will have access to our results and how is our information protected? This is a frequently asked question. So the access to the results, the short answer is your occupational health provider. So these tests are ordered by physicians who work at occupational health. These results are resulted to our electronic health record, which has all sorts of protections. This is a real medical record. So that's where your results are going. Even the Genome Center that runs these barcoded samples, these saliva samples, they don't even have identifying information. All that identifying information is stored within a real electronic medical record. The occupational health providers have that information, and then if it's a positive, they're going to reach out to very select individuals, public health, because that's required by law, and the contact tracing case investigation team who will reach out and make sure that individual knows more about isolation and gets an idea of where their footprint has been on campus so that facilities can be appropriately notified and cleaned. But when we notify other entities on campus, that does not go with identifying information. So if we're reaching out to facilities or anyone else, they don't identify the person, they just identify the campus footprint, like this facility needs to be cleaned. So protected health information is very much protected and is contained within this electronic health record. Next slide, please. Contact tracing. So for confirmed positives, we do have a contact tracing case investigation team that works closely with occupational health. So these individuals then follow up that phone call from the provider, and they talk about who you might have been in contact with, where you might have been on campus, all to collaborate with our public health officials and make sure that we understand which facilities need to be clean and which close contacts may need to be notified. Please do remember that in notification of close contacts, again, your protected health information is not shared. So if we reach out to someone and say, hey, you've been in contact with someone who's identified as having COVID-19, that individual does not get any information about that individual that might have been in contact with them. Currently, we have 8 case investigators and 3 supervisors on the contact tracing case investigation team, but we are rapidly expanding, including partnership with Healthy Davis Together to make the contact tracing case investigation team more robust. FAQs, who is informed when an employee tests positive? Again, it is the contact tracing case investigator who will reach out to that individual, and then other and public health, of course, because by law we report identified information there. And then the facilities contacts and others on campus are not reported based on the specific individual's identifiers. They're just reported, hey, you had someone in this building and this floor needs to be cleaned, kind of information. Do I need to report my positive test to report COVID at ucdavis.edu? It is a campus rule that all tests have to, everyone who's diagnosed with COVID-19 does have to report through the report COVID line. I will tell you that if you got tested here on campus, it's going to end up being duplicate information for us, but it is a good second check and to make sure that everybody who has been notified specifically of a building contact or something, that everyone has been notified appropriately. So you still are required to report your positive test, even though you know that we probably know about it. Next slide, please. Contact tracing, we talked a lot about this already. So how does contact tracing work with California Notify, the new contact tracing app? So California Notify is actually really interesting. It's an innovative app And what happens is it's an opt-in process, and you're going to hear a lot more about it probably over the coming weeks. There's going to be a huge communications push, but in case you haven't heard about it already, it is this app that UC Davis campuses are really encouraged to utilize. You as an individual can go on, sign up, and what it does is if you are diagnosed as positive, you opt in again and say, yes, I want to share that I was positive. You get a special code, and then it notifies people who have been around you who also have the California Notify app that they may have been in contact with someone with COVID-19. The big thing to know about California Notify is, one, you have to opt in at every step. So if at any point you decide not to participate, that is your absolute right. And two is it's very, very confidential. It only looks for other phones that have the CA Notify app enabled, and will only say, hey, you've been in proximity to someone who has subsequently identified as positive within a certain period of time. So your private information is not shared at all. So that is a totally separate process and does not replace the contact tracing case investigation we do for campus. It's just an additional optional safety measure. Next slide, please. All right, so I'm going to turn this over to my colleague, Eric Kvigne, but it sounds like Grant has a question first.
Yeah, before we pass it off to Eric, we got a whole bunch. Well, let me start by saying thank you. You got a lot of thank yous and people that said the testing process was super easy and they appreciated it. We're going to share FAQs for a lot of technical questions online, but would you take a couple of questions real quick, Dr. Schorzman? One is about the accuracy of the test.
Good question. So
how accurate is the test?
Thank you for asking. So this test is 84 to 88% sensitive, but it is much more sensitive for individuals with higher viral counts. So when we look at a test, we see how likely it is to pick up positives. So if you look at everybody with COVID-19 in their system right now, this test is going to pick it up about 84 to 88% of the time, meaning that there are a few individuals up to 12 to 16% that it may miss. But the ones that it's missing tend to have incredibly low viral counts. So they're either just barely starting to get infected, or more often have already been infected and the viral count is coming way, way, way down. And the reason that matters is because you're much more likely to be infectious, much more likely to get other people sick if your viral count is higher and you're like giving off more virus. And screening tests for COVID-19 are designed to help pick up individuals who might be infectious to others. So at those levels, this test is actually very sensitive. As far as specificity, this test has a very high specificity. So what that means in real life is if you have a positive test, it is very unlikely to be a falsely positive test. If your test comes back positive, then it's diagnostic for COVID-19. Other questions?
One other question, back to the notification. Someone had asked, does a supervisor get notified if an employee tests positive? Dr. Schorzman, could you speak to that?
So I will defer that question to Eric Kvigne because he oversees that area of things. Thank you for
Perfect. Asking. Well, he's about to come on. So
yep.
One other question that came in was nobody could believe you can get same day appointments. That's really possible. Can you clarify?
Yeah. We open the gate wide. The reason you saw all those kiosk workers in the background, and we have so many amazing, awesome people working on this project. And generally speaking, same day appointments are available. So yes.
All right. Well, if you don't mind hanging on until the end, we might have some more questions that spring up. But thanks for your all your great information.
Thank you for your time,
Eric. Thank you, Dr.
Thank you, Dr. Schorzman. Thank you, Grant. And good morning, everyone. The question that was deferred to me, I'm pretty sure is on one of the FAQs later on. So let me just hit that when the slide comes up. And I only have 3 slides, so this will go relatively quick. There we go. Okay, so testing requirements. At present, the daily symptom survey does not have any kind of question for self-attestation or validation of complying with the UC Davis COVID testing requirements. That will be added effective December 1st. And the requirement is that all employees who visit campus at least once a week are required to get tested every 7 days. So remember that the Office of the President goal ultimately is to get tested twice per week. So right now we are establishing the process and the volume and capacity to accommodate everyone getting tested every 7 days. So when you're on campus with any frequency, please make a point of scheduling a day every single week. For those employees who visit campus less frequently, then you must test on the day that you access campus. So for example, if you happen to need to come to campus, let's say twice a month, then for those 2 days that you need to be there, plan ahead, get an appointment. And I'll just say that I appreciate that same day appointments are available now. As this ramps up and we get more people into the process, there is no guarantee. So to the extent that you can plan ahead, I would certainly ask that you please do so. So again, the testing requirement there on the slide, it's in accordance with our public health policy launched about two months ago. And then there's the link there for the testing program specifics and parameters. So I'll go to the FAQs on the left. So do I have to get tested if I only work from home? So the simple answer is no. If you never come onto campus, you don't pose, I'll say, a health risk to campus. So technically you don't need to be tested. However, I'd still encourage you to do so. You know, this is a public health benefit to be tested. So there's nothing stopping you, to the extent that you're a UC Davis employee or student, to come in and get tested. Second bullet, do I have to get tested even if I rarely come to campus and only briefly? So as mentioned above, if you come infrequently, you need to plan ahead and schedule your test for the day that you are here. So the answer to that is yes. Do I have to get tested if I work in an off-campus facility or outdoor facility? So think of it from the perspective of any time you need to complete the daily symptom survey, yes, you need to be in compliance with the test because the question will be on the daily symptom survey. I present the answer like that with a little bit of wiggle room because the original intent of the daily symptom survey was to verify no symptoms for accessing a facility, basically being an indoor facility. But since that time, in the original derivation of that questionnaire, there are quite a few circumstances that are, I'll say, quasi outdoors or just outdoors under a tent, for example, where we do require the daily symptom survey. So when the daily symptom survey is required, you're doing an activity or at a facility, yes, you do need to be compliant with the testing protocol. Grant, next slide. Okay, so on the 1st of December, similar to how we added the flu vaccination question, it'll be worded as a yes, no, and it's going to look like this, almost positive. It's going to look like this. I'm just going to hold that room for, there could be a little bit of change, but I think this is what it's going to be. Have you been tested for COVID-19 in the past 7 days? Or, as we mentioned, if you're infrequent coming to campus, the or part of it is, do you have an appointment for COVID testing today? So when you answer yes, you're compliant with the testing program. If you answer no, you're not compliant. The questions there at the bottom left, how will visitors be handled? So visitors are not part of the COVID testing compliance program. As you know, we do have a separate visitor survey that does not require credentials to access. Very much a truncated survey. Do I need my test results before I can enter the facility? And the answer is no, you do not. You need to have an appointment on the same day that you plan to enter a facility. And that's how that question is, that's why that question is worded in the way that it is. So we want to make it as easy for you to work around your schedule for the things that you happen to need to do that day. And then also, more importantly, we want to avoid stacking up a bunch of tests for this purpose at the beginning of a day. So you simply need to have your test scheduled for the day. You don't have to have the result back yet. All right, so in the event you receive the not approved letter, what does it look like? So it's going to tell you a couple things. So first off, you must remain off Davis campus and may not enter university facility. So again, the scope of the program is UC Davis facilities around the Davis area. So we're not including Bodega Bay, we're not including Turk, not including some remote facilities in the south, as well as Sacramento. So you must stay off of Davis campus facilities, with the exception of, if you need to have treatment, right, at one of our clinics, obviously you can go in for treatment. And to the extent that you live on campus, you may access your campus residence. It's also going to tell you, if you're a UC Davis employee, you must immediately contact your supervisor to advise why you're not available to come onto campus that day. So as with any other circumstance where because of illness or otherwise, you need to remain in communication with your supervisor, advise them, hey, I received a red on the symptom survey. I'm not able to access campus facilities today. This is why. All right, the FAQs. How do you handle temporary affiliates that use the survey but aren't eligible for testing? It's a great question. So we, from a programmatic and logic perspective, will be setting up the question effective December 1, so that the question will present to anyone that has a UC Davis employee ID or student ID. Temporary affiliates do not, therefore will not be presented with the question. So they'll still receive the flu question, but will not receive the COVID testing question. Second bullet point there, which I think I'm pretty sure is the one that was asked at the top at the end of Dr. Schorzman. So will supervisors receive a notification when an employee fails the daily symptom survey? So the answer is no, but again, remember the employee receives a letter directing the employee to contact their supervisor. Now, separate and distinct outside of the daily symptom survey will be a compliance process managed within Point and Click that will separately provide a list to supervisors of non-compliant employees, and there will be a separate process to validate that non-compliance, along with reasons for why someone might be out of compliance. So, for example, I haven't tested, Kelly gets a note from on me, I haven't tested in 10 days. And one of the options there is, well, I haven't been on campus in the last 5 days. And I understand that the next time that I come on campus, I'm required to test. It would be type of a survey and validation process to handle that. And I think that's my last slide.
I think that is your last slide, Eric. Thank you very much. I did have a question, maybe to clarify the supervisor notification piece. If an employee tests positive for COVID-19, will the supervisor be notified?
So the employee is required to contact the supervisor to advise that they cannot come to work, just like being sick in any other capacity. The supervisor will not be notified through the testing process that so-and-so tested positive. However, on the facilities portion where we need to clean a facility, we certainly will contact the supervisor and advise, hey, Eric's office has been exposed to viral particles. We need to clean Eric's office or otherwise need it closed within a certain period of time.
One other question, Eric. So you talked about how the daily symptom survey would identify non-affiliates. How about off-campus individuals that are using the daily symptom survey? How will they comply with the question testing if they're off campus?
So I'm not sure I'm answering the question, but let me say that if you're not coming on campus, if you're off campus, you don't need to take the symptom survey because you're not accessing a campus facility. I'm not sure that was the intent of the question. Did I miss it?
And it might be an area for clarification. There were a number of individuals that were talking about, Tulare or Cousteau or
so Cousteau is in the Davis. Yeah. So Cousteau is in the Davis area. They have access to testing. Yes, they need to comply with the daily symptom survey. Tulare does not have access to testing, at least not yet. Therefore, access to the facility there, they do not need to comply with COVID testing.
How about West Sac? Maybe we can clarify all of the local in the Davis testing.
Yeah, I think West Sac is one that I'll say frankly has not come up before. So the way that it's been described is the Davis area. So I think how we need to handle that is rather than define who's in, because I'm sure we'll miss some people within the Davis area. For those that are not sure that they're in the Davis area, please forward a question to a Campus Ready, and we'll run that down.
And my esteemed colleague Brenda Dawson just chatted me that we've defined as Davis campus facilities in Yolo County. So maybe we can clarify again by chat, but I think we're hopefully good. Well, thank you, Eric. You're going to hold on so in case we have some more follow-on questions?
Yes, sir.
I appreciate it. Hi, Julia.
Hello. All right, I'm up. I was going to say, if other folks are as excited as I am about the ability to test and are so fortunate to work for UC Davis, maybe we could show Dr. Schorzman and others some love or thumbs up. If anybody wants to do that, that would be awesome. All right, so as introduction, I'm Julia Johnson and I'm the Manager of Employee and Labor Relations on the Davis campus. And I'm here to assist with questions employees may have. So we'll launch right in. Okay, so what is the responsibility for an employee? Hopefully clear at this point, but the responsibility is if you are accessing campus, if you're physically needing to come into campus to work, you are responsible to schedule a test and to get tested. So as we mentioned, if you're on campus at least once a week, you're testing once a week. If you're coming in sporadically to print something or grab a file, you test as you need to come to campus. So employees do receive paid release time, so you should be testing on your work time. And we're noting to just please work with your supervisor to find a good time so that everyone's not out of the office at once for coverage or whatnot. And to plan ahead, it sounds like right now you could schedule same day, but like Eric was mentioning, that could change. So if you know you need to be on campus at a certain time, just plan ahead to get your schedule, get your appointment scheduled. Okay, so as noted, employees are denied access if you have not met your testing requirement and you take the symptom survey, it will fail you. And it does tell you you need, as an employee, to reach out to your supervisor and let them know that you were denied access to campus. FAQ, do I need to come in before the start of my shift? No, you do not. Testing is on regular work hours. And again, the Wednesday is the expanded hours from 6 to 6. So hopefully that should cover everybody, even graveyard, you know, they could come in and test at the end of their shift in the morning hours. Do all employees need to test? Yes, if you are trying to physically access campus. Hopefully that's pretty clear about employee responsibilities. What do I do if I'm a supervisor? Well, you're making sure your employees are compliant with this policy. So as a reminder, this is in policy, it's PPM 29001, our interim public health policy. So we're as supervisors making sure that employees are compliant with testing. If somebody reaches out to you and says, hey, I did my daily symptom survey and I failed, you're gonna say, okay, as a reminder, do you understand that you are required to test to access campus? You're gonna find out what happened, why the employee didn't test, and you're going to direct them to take action so that they're not in violation of our policy. FAQ, when can an employee who is denied entry come back on campus? Basically, when they can answer the daily symptom survey and it allows them back. So it's gonna ask you, did you test within the last 7 days? If you answer yes, you can come back. Or do you have a testing appointment today? If you answer yes, you can come onto campus. Next slide. All right. So there's also, as Eric highlighted, going to be a background compliance checking process. So what that looks like is if an employee tests, that's considered day 0. On day 8, if they haven't tested again, because remember, if you're on campus all the time, you need to test every week. So if a week has gone by and you did test, but you haven't tested again, you're going to get put onto this non-compliance list that will come to my office, Employee and Labor Relations. So Employee and Labor Relations will reach out directly to the supervisor, say, hey, one of your employees, they had tested and they haven't followed up and tested again within a week. That might be totally fine, right? That employee might not be back on campus anymore. They might have just been popping in to grab a file. They're never going to step foot on campus again. Okay, so it doesn't matter that they missed testing, but we won't know that. But a supervisor will hopefully be able to confirm that. So anyway, we'll reach out to the supervisor, say you had an employee who got added to this non-compliant list. The supervisor is going to send the employee a little questionnaire that says, mark why you missed testing. And that will be on the next slide. So you'll see that in a minute. And then the supervisor will confirm whether that employee, what they put as their reason is valid. Like, oh yeah, my employee was out sick all week last week, so that's why they didn't test, and that's fine. So the supervisor, number 3 here, the supervisor will verify the reason. And then if the person is fine, they'll reach out to student health and counseling to take them off the non-compliant list. Employees, again, if you are still out of compliance, to get in compliance, you need to test, schedule and test. So FAQs, do I need to set a new appointment weekly? Yes. This is, there's not a function that I'm aware of where I scheduled at 8 a.m. on Monday and I now have 8 a.m. on Monday every week. You have to go back in and reschedule yourself weekly or as needed. What notifications and reminders will be received through the appointment system? Right now, there are none, but I was made aware from student health and counseling that in about a week, they're expecting to have notifications. In order to get those, you would have to put your cell phone into, when you go into schedule, it will prompt you to add your phone number if you haven't already added your phone number. And that way you'll be able to get reminders when they're ready to send them. Okay, I think we're ready for the next one. Okay, so this is the list of reasons that if an employee tested on day 0 and didn't test on day 8, the supervisor will send this to their employee and ask them why. And this is, oh no, I actually did test within the last 7 days. That's the first choice. The next one is I wasn't on campus for my regular testing. Maybe you were on vacation, you were out sick, you're on a leave. That's fine, but you're acknowledging you need to test when you want to return to campus. The next one, I'm on campus less than weekly, so I understand when I return, I will test. I'm no longer needing to access campus, but I understand if I do need to access, I will test. I'm exempt from testing. You'll know that from a medical provider for 90 days, or I'm no longer employed at UC Davis. Again, anything that's like, I don't need to come to campus, that's why you didn't test, that's fine. FAQ, what if I couldn't get an appointment in time? Well, it sounds like that will not be a problem because it sounds like you could even get same day appointments right now. But again, it's just employee responsibility to think ahead about when you will need to be on campus and go ahead and get yourself scheduled an appointment. Can an employee work remotely to avoid testing? Okay, so again, if you're working remotely, you don't need to test. Testing is for those physically entering campus. Hopefully by now, I mean, it's probably been flushed out if you're someone that needs to work on campus or not, right? Like certain people, you can only do your job if you're physically on campus. If you're one of those people, you can't avoid testing by just saying I'm going to work at home now, just because it's based on your job duties. So if you think you're someone that can just work at home, talk to your supervisor about that. But you'll probably know already by now if you're someone that works physically on campus. And in that sense, there's not an opt-out, right? If you need to work on campus, you need to test. I will mention that if you'd rather test with your own medical provider, that's fine too. You just need to test weekly if you're on campus, or, you know, test when you need to be on campus. All right, next slide. Oh, that was it. Okay, so this is just a slide for the email address where you can reach out to Campus Ready, and Brenda will assist you with questions in general. There's also a link here for a reach out button that has been added to Employee and Labor Relations website. It's that "we want to hear from you" link down there. So if you have questions about employee compliance or just general questions for Employee and Labor Relations about testing, please don't hesitate to reach out to us.
Hey, Julia, thank you very much.
Thank you.
I had a couple of follow-up questions maybe I can ask that had come in. And you kind of touched on this. So is this testing requirement required for UC Davis Health employees on the Davis campus?
Sure. If you are someone that has a Davis campus lab, for example, I've had that question come my way. I'm a health employee, but I'm physically on the Davis campus for my lab or to do something else, then yes, because just remember, if you're physically coming onto the Davis campus, you need to test. So those folks would test either the day they're coming or plan ahead.
And does the missed test, that email that goes to Employee and Labor Relations, does it only get triggered if an employee has been tested at least once?
Yes. So you're otherwise, gosh, right? There could be so many people who never need to come on campus who it's like, why haven't you tested? Well, I never need to come on campus. So you're only going to get put on that list if you tested once, but then didn't test again within a week.
Hey, Dr. Schorzman, I'm going to ask you and mute. I have a couple of follow-on questions. Some of them are some logistic questions, but what about people parking at the ARC? Isn't it really tough to find a spot, and do you have to pay for it? And what about hours over the holidays and the potentially the curtailment periods? Do you know when testing might or might not be available?
Yes, thank you very much. Those are great questions. So we do have designated parking for COVID-19 testing, and it is free 30-minute parking at what lot? Anyone know? The ARC parking lot, whatever lot that is. It's either 25 or 35. I can never remember.
25.
25, thank you. Thanks, Brenda. So we do have designated spots there, so feel free to avail yourself of those. And as far as holiday hours, they are going to vary. So please check the Campus Ready website. They've been awesome at partnering with us and keeping abreast of our kiosk hours. But essentially, for the Thanksgiving holiday this week, we are closed at the kiosk Thursday, Friday, Saturday. We open back up Sunday with regular hours. And then for the winter holidays, we are testing on regular schedule through the 20th. We are closed the 21st for testing, but we'll be opening a small kiosk on the 26th to help accommodate some individuals who need testing. Otherwise, our campus kiosk is closed from December 21st through January 1st. We open back up January 2nd. But in case you couldn't keep track of all of that, it's all on the Campus Ready website, and we will keep that updated. We will have some additional testing options as we partner with the Healthy Davis Together kiosk. So more information on that as we formalize that procedure will be also on the Campus Ready website.
How many appointments can somebody make in advance? Can they schedule these out weeks and weeks and weeks in advance?
Right now, no. And we have heard clearly that people would love to be able to do one and done as far as making that appointment every Monday at 8 a.m. forever. We don't have that capacity yet, but we have asked for that as an improvement in the software. So hopefully that will be an option in the future. Right now, you're only able to schedule out 7 days in advance.
Here's a technical question that kind of came up from a number of people. Are the samples exclusively used for this test, or do they get destroyed immediately after?
That is a good question. So and it may be because during our parallel testing, that was considered a research project. So back before, when we were doing the saliva sample and the nasal swab together, we did that under a research study. We did that under IRB. So you may have had to sign a research consent when you did that. We are done with parallel testing. We're only doing saliva testing. So right now, the saliva is only being used for this purpose. It is not being destroyed immediately because we need to bank it for a couple weeks in case that there was a problem with the test resulting. We need to be able to run it again, but it's only being used for this diagnostic testing. They are looking at potentially starting another optional research project further on down the line. But remember, those samples at the Genome Center are de-identified data. So they are also using them, I should say, for kind of internal experiments with, can we run one little test in this well, or can we run 3 tests in this well to increase capacity? So they're being used for internal improvement of projects like that as well. But there's absolutely no way to compare those samples back to the individual who gave that sample. They're de-identified. So they are being used, it's called quality improvement projects, which actually labs do all the time with within those parameters. But as far as identified information where they can tell who that person is, it's only being used for this diagnostic test.
Hey, thanks, Dr. Schorzman. And I unmuted, asked Eric Kvigne to unmute. Maybe the two of you together have the answer to this. We said results are reported within 24 to 48 hours. Have there been any delays? And if, you know, and what should people do? Where should they go to find their results if they can't find them?
I can start the answer to that. So with the increase of volume, especially 11/18, when we opened the gates wide to approximately 20,000 individuals who are allowed to test at the kiosk, all employees and registered students, the lab that processes these got hit by quite a large sample size that they hadn't had before. So they're still refining their processes. So there's some delays a little bit out there as those samples work their way through the lab as they refine their processes and workflow. And there's also some potential delays as those samples come back, because it does take a real person to acknowledge those results and send those out to the individual people. But right now we're still getting most results out within 72 hours, and we're hoping very soon to get back to our 24 to 48 hour turnaround time as soon as we work out these processes.
That's great. One other question, and maybe Eric, this is a question you can answer. Can someone get tested outside of campus if they wanted to use this as their testing?
Mm-hmm.
Yeah, certainly. Please keep a copy of the test. There will be a point in the future by which I think when the daily symptom survey gets migrated over to point and click, it'll have the capability to upload those kind of forms. So again, when you're answering the daily symptom survey and confirming that you're complying with 7-day testing is subject to verification. So you just want to make sure that you can back that up should the need arise for that verification.
Okay, well, we're at time now. And I will say that I've received a number of questions via chat, and most of them, I think we answered, a number of them we did not and could use some further clarification. And our intent is to post better FAQs and answers on the Campus Ready website as soon as we can, because all your questions are answers and they're good ones. So I want to say thank you very much to everybody for coming, and each of you presenters got your own kudos respectively. So great job. This recording and the slide deck will also be available. Take care, everybody. Thanks for coming.